session. Today we are covering housing services and member eligibility. Thank you everyone who is joining us. I'm going to wait a second or two before we officially kick things off as we wait for folks to trickle in. But thank you all for being here. Right, for folks who are just joining, we'll do formal housekeeping in a sec, but just wanted to let you know that we have language interpretation for today's session. If you need an interpreter, click the interpretation icon at the bottom, and there will be Spanish interpretation for today. And it looks like we just had a few more folks join us. Hi, everyone. Welcome. This is the Health Related Social Needs training series. Today's session, we are covering housing services and member eligibility. If you are a HRSN service provider or you are interested in becoming one, this is the session for you. If you are not a service provider and are just interested, we are happy to have you here. Everyone's welcome, but the content is aimed at service providers. And I think I will officially kick us off. Hi, everyone. My name is Tanya Curiel. I am part of the team helping provide training to HRSN service providers. We are also joined by a lot of wonderful colleagues in the waiver housing team who are going to be helping provide content today. If we could go to the next slide, please. Thank you. A few housekeeping items. Today we're going to do things a little different than usual with how we answer questions. So normally we answer questions kind of on the fly, but since we have so much housing content to cover today, and hopefully we'll answer your questions, we're going to try to save our questions to the end. So you're welcome to put your questions in the chat so you don't forget them. But we're not ignoring you. We are just saving questions for the end. We'll make sure to leave plenty of time to get to your questions. Also know that this session is being recorded. So if you want to come back to this session later on, we will send you a recording. We are also going to send you a copy of the slide deck, so you'll have that as well. This session is also going to be repeated next week. So you may have gotten a registration link for next week. It's all going to be the same content. You're welcome to come again to that, but it will be the same. And if you found this session valuable, you could also share it with your colleagues and ask them to join next week. We have closed captioning, so you can click on the CC button at the bottom of your screen and get closed captioning. And we also have live interpretation. So if you want to listen to this in Spanish, you can click on the interpretation icon at the bottom of your screen. And we have two wonderful interpreters with us today who will be helping with the interpretation. Next slide, please. All right, now for today's agenda. We are going to start by doing an overview of health-related social needs. And we're going to learn about what the HRSN services are and talk a little bit about two of the HRSN benefits. Most of our training today will be about housing, but we're going to touch on outreach and engagement just a little to try to encourage you to become an outreach and engagement service provider because we think that's a valuable addition for housing providers as well. After that, we'll go do a deep dive into housing services eligibility. We'll talk through the different HRSN housing benefits, the eligibility criteria for each one, and what documentation a member will need to provide to get these services approved. We'll wrap up the training going over some frequently asked questions about housing. We'll give you a lot of great resources that can help you in your housing service provider journey. And then we'll have plenty of time to answer questions. And we have our experts in housing here in the room with us that can help answer your questions. So with that, let's get things started. Next slide, please. All right, let's talk about HRSN services. Next slide, please. So most of you will probably already know what HRSN is, but if you don't, we are going to say the acronym HRSN a lot today, and that stands for Health-Related Social Needs. These are a new benefit that can help eligible OHP members improve their health. There are four different HRSN benefits: climate supports, outreach and engagement services. And then starting in November, we'll be launching housing supports. And in 2025, we will have nutrition or food supports. So, a lot of exciting things coming up. And this training will focus on housing. Next slide, please. But before we jump into housing, quick little pause to talk about outreach and engagement services. So the goal of the HRSN outreach and engagement services are to help identify OHP members who might be eligible for HRSN services. Um, it's also to help eligible members get HRSN services and help with the connection of connecting OHP members to healthcare and non-healthcare services. And importantly, also providing these services in a way that is accessible, culturally specific, and culturally responsive. Um, Outreach and engagement activities are available now, but coming November 1st, alongside the housing benefit, there will be more services starting as well. Next slide. And we are encouraging our housing providers to also become outreach and engagement providers because with being an outreach and engagement provider, you will be able to bill for a lot of the work that happens before someone can start receiving housing benefits. So the outreach that you are doing, if you are helping someone that comes to you that wants to get HRSN services, if you think somebody that you are working with could be eligible, all of that outreach and engagement work that you are already doing to get them to get started with housing services can be a billable activity. The steps that you take before providing housing services, like checking if someone is enrolled in a CCO or open card, if you are verifying if they are presumed eligible for an HRSN service, filling out HRSN request forms, all of these things that you can do to better support a member that might get housing benefits can be covered if you are also an outreach and engagement provider. So I know this was a very quick little overview of outreach and engagement, but hopefully that sparks your interest. So if you are considering becoming an outreach and engagement provider, last month we had a training session where we covered this in great detail. There is a link at the bottom of the screen where we have that training. So encourage you to watch it and encourage you to also become an outreach and engagement provider. Okay, but I know you all are here to hear about housing, so I'm going to stop talking about non-housing things and I'm going to hand it over to my colleague to talk about housing benefits a bit more.
I think you can move it to the next one. Yeah, hi everybody. My name is Avita Marnell. I use she, her pronouns, and I'm a health and housing policy analyst at Oregon Housing Community Services. Just going to jump right in, talking about the housing services for HRSN, and that the goal of HRSN again is to support people to stay in housing and prevent homelessness. So that is the goal of our housing services, which will start November 1. That's when the launch begins, coming up in just a few weeks. So we're going to talk about eligibility. Who is eligible to get housing benefits? So HRN services are only available to Oregon Health Plan members. So that's always your step one. Make sure folks are enrolled before, sorry, I have all these things popping up. I'm trying to move them out of my way. So making sure that folks are enrolled in Oregon Health Plan is going to be your first step to make sure that they'll be continue the process. There are different housing benefits depending on the member's need, and the eligibility does vary by service, and each service may have its own eligibility requirements. So just to keep that in mind, and you can move to the next slide, please. So types of housing benefits. So we have tenancy supports, also maybe heard as case management, which is just helping folks get resources and services. So this is a service that can exist on its own. If somebody is just interested in tenancy supports, that is possible. Another one is the rental assistance for up to 6 months, and this includes past due amounts. So it's just going to be a total of six, whether it's past, moving forward. If you're receiving rental assistance, you're also going to be eligible for utility setup and cost. Again, this is past due amounts, past due amounts and moving forward, and it's only for folks that are receiving rental assistance. Similarly, storage fees. You must also be receiving rental assistance to be eligible for those. The third is medically necessary home accessibility modifications and remediations. So examples are ramp and grab bar installation, pest control, and heavy duty cleaning and related hotel costs. Those are going to be the types of housing benefits that we're going to be talking about. So if you could move to the next one. Okay. So HRSN housing eligibility, keep on moving to the next slide, please. Okay, so again, to be eligible for HRSN housing services, you must meet the eligibility requirements and submit appropriate documentation for these requirements. So step one, somebody needs to be a current OHP member, and two, have at least one housing clinical risk factor and meet additional criteria for the specific housing benefit. So it says we'll start here on the first two, since these apply to all HRSN benefits, and then we're going to dive into benefit specific requirements after that. So you can move to the next one. Okay. So before providing services, you must verify that a person has an Oregon health plan. Otherwise, you might not get paid. So you can do this by checking MMIS or calling so the Oregon Eligibility Customer Service number. So you determine if the member is enrolled in a CCO or an open card, and you'll have to be contracted with their CCO or open card to bill for the services you provide. If the person does not have Oregon Health Plan, you can help connect them to enrollment help. And here are some examples below. You can contact ODHS. You can contact the OHP certified community partner and look at the One Oregon .gov website. Another note is that HRN service providers are required to verify OHP status directly. And you can't just presume that they're eligible because someone tells you that they have Oregon Health Plan. You have to verify that yourself before moving on to the next steps. So next slide, please. Okay, so in addition, for eligibility, you must have a clinical risk factor. Just one of these at minimum. So some include complex behavioral physical health conditions, developmental disabilities, needing assistance with ADLs, or is eligible for long-term services and supports, current or past interpersonal violence experience, repeated emergency department use, crisis encounters, currently pregnant or 12 months postpartum and at risk of certain clinical risk factors, less than 6 years of age and at risk of certain clinical risk factors, and more than 65 and at risk of certain clinical risk factors. So a diagnosis and something written from a provider is not required. Self-attestation is allowed. And so there's no expectation that housing providers are going to have to provide any clinical proof that somebody has one of these risk factors. And the CCO and open card will review the previous records to verify that. And next slide. So for documentation, documenting clinical risk factors. Individual can tell you that they have one or more of these risk factors, and that's called self-attestation. So like I mentioned, a clinical diagnosis is not required. And when the CCO gets the HRSN request form, they can review the medical records and claims to support the self-attestation by the member. And we're going to keep going to the housing specific requirements. Over to Danielle.
Great, thanks, Evita. Hi, everyone. My name is Danielle Bautista Silton, and I use she, her pronouns, and I work on with Oregon Housing Community Services and support the housing team. We're going to talk about some of the benefit-specific requirements on top of the other things that Evita noted. Next slide, please. So the first, we'll talk about rent payments and tenancy supports. Next slide, please. Okay, so first, tenancy supports. tenancy supports, often referred to as case management. These are critical services to keep people housed. And these are intended to connect renters with resources and services to help them keep their housing rather than find new housing. There are different ways housing providers can use tenancy services to bill for time. The first way is to coordinate and ensure HRSN housing services are delivered. The second is to speak with the member's CCO or open card care coordination team. Can also be used to provide training and resources to assist someone to understand their lease. And then, of course, support the members in achieving their housing goals. And then you can also use this to build time for communicating with the landlord. It's important to note that tenancy services are voluntary for the member. So they're not required for them to participate in tenancy service to be eligible for HRSN housing services. Another note is that tenancy supports can be a standalone service. So someone can just receive tenancy supports, or they can receive them alongside other HRSN services. Next slide, please. Okay, so this slide talks about tenancy and rent assistance, who is eligible for them. And it's important to note that while tenancy supports and rent assistance are two separate benefits, they do have the same requirements. So a member can can apply for one or both if needed. So in addition to being an OHP member and having at least one clinical risk factor, to be eligible, they must meet these additional criteria. The first is they have to belong to at risk of homelessness or HRSN population. And at risk has two components. That means one, they have an income that is 30% or less than the median income in their area, and two, lack sufficient resources or support networks to prevent homelessness. The other component is someone must have housing already, and they need support to stay in their current housing. And they also have a lease or written agreement with their landlord. Next slide, please. So how do we document the at-risk piece? As we discussed in the previous slides, there are two components to at-risk. There's the income, the 30% area median income, and there's also the lack sufficient resources support networks to prevent homelessness. For income, you can help a member document gross income documentation for all adults in the household for the last 2 months. Next slide, please. Here's a little bit more about documenting income. So it's documenting the gross income in one of the following ways in order of preference. For some housing providers, this is modeled off of OHCS and HUD standards, so this might look familiar to you. So the first preference is third-party verification. So this could be a copy of most recent pay stubs, unemployment, SSI, SSDI award letters, or other third-party verification documents. The second preference is a written statement by a case manager, social worker, or other staff who can attest to the member's income. And the last is self-attestation. The HRSN provider website has templates and a list of income sources to include and exclude from the income calculation, as well as acceptable documentation. And again, income should reflect their previous 2-month earning. Next slide, please. So one important note, question that we often get is how are the income requirements different? So reminder that this is looking at income of 30% or less of the area median income. So here it shows who to include in the household. So first determine what county in Oregon the person lives in, then determine how many people are in the household, and then check the income table in the HRSN income limits document. And then from there, get the last 2 months of income for HRSN rent assistance eligibility. Next slide, please. Here's more service-specific documentation for rental assistance. As I mentioned, there needs to be a lease or written agreement. If there's a written agreement, it would need to include certain components as listed there. Or there is a template that'll be listed on the website that shows verification of a landlord-tenant relationship and rent owed form. Another note is that the lease address must match the address in the CCO or open cards records. And then members who are doubled up or living with another household due to economic strains do not need to be on lease. However, they must hold a written agreement with the landlord or occupancy. Next slide, please. For documentation of rent arrears, this is late rent, need to show the number of months owed and the amount. For utility payment, needs to include a utility bill, and the address must be the same as the address on the lease or written agreement. For utility arrears and setup, it would need to include the utility bill. And again, the address must be the same as the address on the lease or written agreement. Or if the member or parent caregiver name is not on the utility bill, then the member or caregiver must submit documentation to verify that the address for this service is the member's primary address. And then there are documents of accepted forms of residency verification listed below. For storage, there are no other additional documentation requirements. Okay, so next slide, and I will hand it over to Callie.
Great. Hi, everyone. Good afternoon. My name is Callie Glenn Haley, and I am also part of the housing team on the 1115 waiver. I'm going to talk through the eligibility requirements for home modifications and remediations. So in addition to needing to be an OHP member and have a housing clinical risk factor, which is what Avita went through at the beginning, there are a few more requirements for the home modifications and remediation benefit. Next slide. Thank you. Okay, so in addition to being an OHP member and having a clinical risk factor, to be eligible for home modifications and remediation services, an individual must also belong to what we're calling an HRSN covered population. Those of you who've been to our trainings before, this list may be familiar to you. A lot of the other HRSN benefits use these same populations for eligibility. So these populations for home modifications and remediations, number one, people who fit the definition for at risk of homelessness. This, we're using the HUD definition, and so it actually corresponds to what Danielle went over of 30% area median income or less and lacks resources to prevent homelessness. That's how we're defining at risk. The next one is youth and adults discharged from a behavioral health facility, folks who are released from incarceration, individuals who are currently or previously involved in Oregon's child welfare system, individuals transitioning from Medicaid to Medicare status, and young adults with special healthcare needs starting in 2025. So in addition to being part of one of these covered populations, the member must also need the home modification or remediation service in order to help either treat or prevent or improve their clinical risk factor, their health condition. It is open to people who own their homes and open to renters, but we do require a landlord approval for renters. Next slide. So to be part of the, to show documentation requirements for being part of a covered population, we're requiring a self-attestation. And for the at-risk of homelessness group, Danielle went over those documentation requirements in previous slides for the 30% area median income component and the lax resources and support networks to prevent homelessness. Next slide. Okay, and then more documentation requirements. So to go a little bit deeper into what we mean with home modifications or remediations, there are specific services included under this. Includes ramps, grab bars, door handles, pest control, deep cleaning or chore services, and the installation of washable curtains or synthetic blinds to prevent allergens. So these are the services that we are including under this benefit. And in order to receive it, we're also requiring a written scope of work that is agreed upon by the landlord, if applicable, the contractor that is doing the work, the service provider, and the member, so that everyone involved is on the same page of what will be included within this service. We expect that this will likely involve, for many of these services, a visit to the member's home to assess the specifications of what is needed. It also needs to comply with local codes, and if any permitting is necessary, that is also included. The landlord must provide written consent, and in the case of, I guess, per Oregon's tenant law, landlords must agree to modifications in the cases of disability. So we expect most of these to fall within this, but that landlord consent is necessary. And going back to what Tanya had said initially about O&E or outreach and engagement providers, we expect that outreach and engagement providers will be really crucial in gathering this documentation for members to submit to apply for HRSN services. So we'll be going through that application process in later slides, so more to come on that. For hotel motels, this service is available to people who are receiving the HRSN home modification or remediation benefit and need a place to stay while the work is being done on their homes. Unfortunately, this eligibility is slightly different. It's only available to people who meet that at risk of homelessness definition. So it's not available to all of the covered populations. And this is just due to a requirement from our federal partners. So next slide. All right, I believe I'll pass it over to Tanya.
Thank you, Callie. All right, in this next section, we'll talk a little bit about who the service providers are for housing and who they get to work with. So next slide, please. So who provides HRSN benefits? The Oregon Health Plan is administered by the Oregon Health Authority and 16 coordinated care organizations. So these are the health plans that will be helping provide the health-related social needs benefits. And the CCOs and Open Card are going to be working with HRSN service providers, and those can include community-based organizations and others like you all on the call that will be providing these services. As an HRSN service provider, you get to contract with a coordinated care organization, one or more in your area, and you can also choose to contract directly with the Oregon Health Authority. That's also known as Open Card or fee for service, or if you're really deep into the Open Card world, you might know it as DMAP. So you get to choose, do you work with one? Do you work with two? Do you work with three? That's a choice you get to make about who you want to contract with. Another choice you get to make is how many HRSN services you get to provide. So if your organization is really well set up to provide housing and food supports and climate supports, and you all do it all, you can do all of the HRSN services. Most organizations will be best suited for one or two. So for all of you, it might be housing and outreach and engagement, but that's for you all to decide. Next slide, please. All right, and we said you can contract with a CCO or Open Card. So what are these acronyms? Coordinated care organizations are health plans that provide Oregon Health Plan services to most of the members that have OHP. So most OHP members, they will be enrolled in a CCO or a health plan that is local to them. Most areas across Oregon have one CCO, some have more. And OHP members get a choice if they have more CCOs in their area than one. But about 10% of members are on what we call Open Card or fee for service. And that's when there is not a local health plan managing their care and they get their care managed directly by the state. Since it's only 10% of members, it's not too many, but we do encourage all of our service providers to also work with Open Card so that you can serve all the members that come to you. And yeah, so we encourage you to apply with both. To apply with Open Card, you do that directly with the state. And to apply with a CCO, you have to contact the CCO directly. And later on in the training, we'll have a link to a web page that has all the contact information for the local CCOs. And we will provide contact. There's a lot of questions coming through about who do we contact, and we will give you all the contact information. And if we could go to the next slide, please. Now, I don't know if you can see this map clearly, but if you know off the top of your head, I would love to see a quick poll in the chat of who your local CCO is. You might know this, you might already work with them, but if you look at the map, you might see like, oh, okay, I live in Eastern Oregon and Umatilla, that's EOCCO. Yeah, so a lot of people know who their CCOs are. That is great. So you get to choose and contact them directly to do your enrollment with them. And then you also do your enrollment with us, with OHA. I love that everybody knows their CCO like really quickly. That's great. CCOs would be happy to see that. All right, next slide, please. All right, and with that, I'll hand it over to Callie to talk about the service provider experience.
Great. Okay, this is kind of the process flow for becoming and being an HRSN service provider. I saw a few questions earlier in the chat that I hope this section will really answer things for. So this is kind of the high level slide, enrolling in as an HRSN provider, filling out what we're calling an HRSN request form, verifying eligibility and getting authorization, getting a referral and providing the service, billing and reporting, and then step 6 should actually just read reporting. Next slide. Okay, so enrolling as an HRSN service provider. We have a training online that goes over HRSN provider qualifications and lists out what these qualifications are. Enroll as an HRSN provider with the CCO in your area. If there are more than one CCOs, you can enroll with multiple. And we're also asking that HRSN service providers or those CBOs who are interested in becoming one also enroll with Open Card. So for CCOs, you can contact the CCO in your area. Most of them have HRSN web pages on their website. If you click the link inside this presentation, which we'll be sending out, it will take you to a page which will have each CCO's website linked within it. For Open Card, you can visit OHA's provider enrollment webpage and enroll from there. We also have a training that's recorded, similar to this series, on how to enroll as a provider. Once you've enrolled, each CCO may have a slightly different process for billing, and also Open Card has its own process as well. And so make sure to learn from the CCO, read their materials as to how their process works. And to answer Christina's question, yes, there has to be an agreement in place that the CCO, that you're part of that CCO's network. This is different than being a Medicare or Medicaid provider, but we are asking that everyone enroll in the Medicaid system so that our payment processes can work. And I'm seeing Sarah's question in the chat. This is a great question. If you want to be paid, you have to work with the CCO that you are contracted with, but there's nothing that stops you from enrolling with multiple CCOs. So even if you have, if you've received, for example, community capacity building funding from a CCO, that doesn't mean that you can only work with them. You can also enroll with other CCOs in your area of operations. Next slide. You can apply to be an HRSN service provider for any of the HRSN benefits. So climate, housing, nutrition, outreach, and engagement. So as many as you feel competent to apply, to provide, you can enroll for. We do, and we've noted this before in this presentation, but we do recommend enrolling as an outreach and engagement provider alongside any other HRSN service, because that allows you to be paid for any work you do submitting the application on behalf of your clients for HRSN services, which we'll get to in a moment. But if you're an outreach and engagement provider, you can be paid for this time. You can enroll with multiple CCOs in your service area and with Open Card. And for housing, we've gone over multiple different types of benefits within HRSN housing. So rent assistance, tenancy support, utilities, home modifications, et cetera. And you can enroll and do all of those services, or you can enroll and only focus on one or two. Next slide. Okay, step 2, this is really how you start the process of requesting services for your clients, for your existing caseload, or any new OHP members that you identify that you think might be eligible. So we have the process kicks off with what is called the HRSN request form. This is a form that is used to ask that the CCO or Open Card review the member's eligibility and determine if they are eligible and authorize services. So the HRSN provider webpage links to this form for housing, or it will link as of November 1st. We'll post this form in English and then all of our other translated languages on our HRSN provider website. CCOs may also have their own forms, which are available on their websites. So keep an eye out for that. Next slide. The form that you have to use, you could use the CCO's form, OHA's form, or if your organization has an intake form, you can also use that. We've intentionally tried to make this very flexible as to what you can submit to kick off this process. And the minimum information that the form has to include is the member's name, their contact information, and the HRSN service that they want. Once you support a member to fill out this form, it should be submitted to the OHP member's health plan. So that would be their CCO or Open Card, depending where they're enrolled. OHP members can fill out the form by themselves or work with their service providers to do so. And we just, earlier in the presentation, we went through all of the documentation that's required for HRSN services, housing services, to ultimately be authorized. But the HRSN request form is kind of the kickoff. So you can submit the form with the bare minimum information required, or you can really work with the member to submit kind of a packet of all of the information, all of the documentation that's required, or as much documentation as the member has available, and then follow up with them to work with them to collect the additional documentation and submit it to the CCO. Next slide. So because working with members to collect all documentation can be time consuming, we are making the plug again that HRSN service providers enroll as outreach and engagement providers in addition to enrolling as a housing provider, so that they can be paid for this time. And we have a provider TA training on outreach and engagement on our website. Next slide. Okay, so once the HRSN request form is submitted, the CCO or Open Card has 14 days to authorize services or deny services. So this is where, if you as a service provider are helping the member gather the additional documentation, that can be really helpful for the CCO to be compiling it all in one place and reviewing it. The CCO can also reach out to the member directly to ask for the rest of the required documentation, but having HRSN service providers support that process, I think, is beneficial. So once the CCO or open card provider or health plan compiles all of the documents and reviews, if they find the individual to be eligible for HRSN housing services, they'll authorize the service and refer the member to a service provider. Now, if you, as a service provider, have helped the member to compile all of this documentation, it is very likely that the CCO will refer the member back to you. If the member or the individual is denied services, they can appeal the decision. So OHA has a process, hearings and appeals for members who think that they are eligible or entitled to a service under their Oregon Health Plan, and they've been denied that service, and then they go through an appeal process. One more thing just to note here, and I know this is a lot of information, is that there is this 14-day timeline for CCOs or open card to authorize or deny services is a fairly long period of time. And then there's an additional time allowed for the actual provision of services. So if that's too long, if you're working with an individual, for example, who has an eviction notice in hand, you may want to either flag an expedited request in your HRSN request form, or help them secure other funding to meet their immediate need, and then apply for HRSN services as a follow-on support. So just keep in mind that 14-day timeline and have a conversation with the CCO about the unique circumstance of that member, and kind of plan accordingly. Next slide. Okay, so after the member has requested the service, the documentation has been compiled, the CCO authorizes the service, sends a referral to the HRSN service provider. In most cases, it will be the same organization that helped the individual compile their requests. In some cases, maybe the individual will request another organization, or maybe the organization doesn't offer the service that they want. Those might be scenarios where the CCO would refer to a different organization, different HRSN service provider. One thing to note is that you can accept referrals, or if you don't have any more bandwidth in your caseload, you can also decline referrals. And it's up to the CCO to find an alternative HRSN provider. If you accept the referral, you can provide the authorized services according to your organization's processes and practices. And the CCO and open card, they are really on the hook to ensure that the service, at least the initial service, is delivered within 4 weeks of it being authorized. Next slide. Okay, submit a bill and get a payment. So now that you've provided the service, you want to be paid for it. Who you bill ultimately depends on whether you're working with the CCO or open card. If you're working with the CCO, you send that bill to the CCO directly and get paid within 30 days of sending it. They may have their own processes for submitting bills. And if you're working with open card or fee for service, you send a bill to IN, OHA's contractor, and we do have a training on how to do that, on how to invoice IN. Just to note, so in many cases, providers will be working on a reimbursable basis. There may be some flexibility with CCOs, but in general, providers would be working on a reimbursable basis. The second thing to note about that is that for paying rent or paying utilities, it's possible for the CCO to pay the rent directly, or the HRSN service provider, depending on what makes the most sense. In some cases, HRSN service providers would prefer to pay the landlord and be reimbursed, even if that means, or just so that you can kind of keep everything within the same organization rather than communicating with the landlord and then following up with the CCO to issue the payment. We've intentionally made it so that either entity can issue the payment to the landlord directly. So just to note that. Next slide. Track and report HRSN data. As an HRSN provider, there's a few data points that we are requiring of CCOs, and so then we assume that they may flow down these requirements to you all. So the status of the referral, whether it was accepted by you or rejected by you, the date that you or your organization first tried to contact the member. So after the services have been authorized, you reach out to the member. How long does that take to do? If the services were delivered, if they weren't delivered, why not? And we are working on utilizing community information exchange to provide a platform to like kind of capture a lot of this data and uh, to issue these referrals. But currently, you can also use another system if that's what you have. Next slide. Okay, I'm going to hand this over to my colleague to go over a case example just to get us in the zone of thinking about this process and how it could apply to an individual.
Yeah, thank you. So we went over a lot of information, and now we'll talk about how this works in an example. Next slide, please. Here we have an example of Louise. So Louise is a caregiver in Hood River, makes $18,000 a year and lives alone, is 3 months behind on rent and was issued an eviction notice. Louise does not have a support network that can help her and lives paycheck to paycheck. An HRSN provider organization. A coworker suggests to Louise to contact New Hope Solutions for rental assistance. Louise meets with a case manager named Gustavo and mentions that she lives with bipolar disorder. Gustavo believes that Louise might be able to get HRSN supports, so he starts helping her with that process. And since HRSN service takes some time to compile the documentation and get approval, Gustavo helps Louise get eviction support from the county in the meantime. Next slide. So we have a little bit of information about Louise's situation. So we'll talk about Gustavo's workflow and then the CCO workflow. So for Gustavo at the HRSN service provider, Louise tells Gustavo that she's enrolled in OHP and has Pacific Source as her CCO. Gustavo calls Pacific Source to verify that her OHP and CCO enrollment are active. And he helps her fill out an HRSN request form and sends it to Pacific Source. Gustavo tracks the time he spent helping Louise fill out and submit the HRSN request form to Pacific Source. On the CCO end, the Pacific Source Care Coordinator, Mark, gets the request form and sees that Louise might be eligible for HRSN rent assistance. Mark checks Louise's records and confirms her self-attestation of bipolar disorder. And then Mark reaches out to Gustavo and Louise to collect any remaining documentation. And then once required documentation is submitted, Mark approves the request for HRSN rent assistance and tenancy supports. And then Mark then sends the referral back to New Hope Solutions. Next slide, please. So looking back at the eligibility criteria for rent assistance and tenancy supports. First, the member has to be on OHP, and Gustavo did this by calling Louise's CCO, Pacific Source. The member needs to have at least one clinical risk factor. In this case, Gustavo noted that Louise had self-attested to having a clinical risk factor, the bipolar disorder. And then the member needs to be at risk of homelessness. So first need to meet the 30% area median income. So Gustavo helped Louise get her 2 most recent pay stubs and references the income guide to confirm that her income is under 30% of the median income in her area. And then the member needs to lack sufficient resources or support networks to prevent homelessness. So Louise is living paycheck to paycheck and doesn't have any supports. We also need to confirm that the member needs support staying in their current house. So we know that Louise is at risk of being evicted. And then the member needs to have a written agreement with the landlord or lease. And so Louise has a lease and Gustavo helped her call her landlord to get a copy. Next slide, please. And here's more detail of the HRSN service provider workflow at New Hope Solutions. So once New Hope Solutions has the service authorization and referral, they accept the referral and assign Louise to Gustavo's caseload. Gustavo follows their procedures and prepares and send a rent check to Louise's landlord. He also helps Louise create a housing retention plan, and Gustavo tracks the time he spent on Louise's case under HRSN tenancy supports. New Hope Solutions bills Pacific Source for the time Gustavo spent helping Louise. And since New Hope Solutions is both an HRSN housing and HRSN O&E provider, they bill for the time spent on working on the HRS request form, the rent paid to the landlord, and the time spent with Louise and Mark to ensure the rent assistance was received. And then Pacific Source pays New Hope Solutions within 30 days. Next slide, please. As far as record and reporting. So throughout the process, Gustavo uses the New Hope Solutions case management platform to track the following for each HRSN service. So he documented when he first tried to contact Louise, after Pacific Source authorized rent assistance and tenancy supports, and then tracked the outcome for the service. So it has to document whether the service was provided, then he would write service provided. If the service was not provided, he could write Louise was not interested or Louise couldn't be reached. And then New Hope Solutions sends a report of this data to Pacific Source at the end of the quarter. Next slide, please.
All right. I think we have time for a couple of other, maybe one more interactive example. Is that I'm getting a nod from Tanya, and then we'll move to some FAQ and additional resources and end with Q&A so that we leave time for that. So next slide. Okay. Case 2, we have Josephine. Josephine is a 25-year-old artist who lost her job at a retail shop when she was diagnosed with systemic lupus. Josephine is on OHP and doesn't have an income. She decided to be proactive and move in with her best friend and is sleeping on the couch, and she has rented storage space for her furniture and supplies. And over time, Josephine's friend has mentioned to her that there are increased utility costs, and and there's some tension in the space, and they are considering how sustainable this is. And so Josephine wants to find a way to pitch in for utilities and rent until she gets a new job. So I'll see if there's any brave person who wants to raise their hand and guess what services you think Josephine is eligible for. Okay, I don't see a hand, but we can walk through. So we have the 30% or less AMI. So since she's unemployed, she doesn't have an income. The previous 2 months, there's a 0% zero income. So she meets the 30% AMI threshold. She is doubled up with her friend and doesn't have another place to go, is sleeping on the couch. And if her friend wants her to move along, she doesn't have another option. She has systemic lupus. So in this case, she can work with the landlord to secure a written agreement that shows that she is now living in the apartment or space of her friend. um, and would be eligible for HRSN, rent assistance, and utilities assistance and storage fees. So in order to receive these services, she would need to work with her case manager and O&E provider to show a lack of income, could be a bank statement, or the case manager could walk through her story with her and write and attest on her behalf that she doesn't have an income um, and that she lacks resources to prevent homelessness. She can then work with her friend and her landlord to fill out a written agreement of tenancy. She does not have to be on the lease as someone who's doubled up. She does not have to get a new lease with the landlord, so long as the landlord just does a written agreement. And then if she is able to submit a utility bill, I think I'm like, am I missing anything? And a utility bill to show the utility bills coming in. And that is the documentation she would need to take advantage of HRSN housing benefits. Okay. Tanya, do you think we have time for one more, or should we move to FAQs?
We could go quick. Actually, maybe do you mind if we answer both of the questions about Josephine in the chat?
Sure. Okay. Yeah, so great question about what type of limits HRSN can pay for Josephine or for any of these examples. So on the HRSN provider website, we have what's called the housing fee schedule. The housing fee schedule outlines the upper payment limit. So it's a Medicaid term for the max amount of money that that can be provided or that can be paid for this service. So we're going to have a provider TA session on payments coming up soon. So hold tight for that. But in the meantime, you can review that fee schedule and you'll see that depending on the geographic location of the individual and the number of bedrooms in the home, how much our upper payment limit would be. We're doing 150% of the of kind of the fair market value of that HUD releases to take into account that utilities alongside rent could be quite a bit more expensive. For Josephine, because this is a doubled up situation, she would be only kind of paying for one bedroom. She's on the couch, but like kind of one room. Even if the house had, let's say, 3 rooms, but she's only using one and she's kind of and she's doubled up, it would be for kind of her household. So that's how you would determine the upper payment limit for it. And Tanya has yes, November 19th. So Andrew, yeah, so we are requiring that she does work with the landlord and that this written agreement is agreed upon with the landlord and the primary leaseholder. Yeah. And Sarah, you're right. Unfortunately, if the landlord does not agree to her being there, she would not qualify for rent support. She could, however, oh no, yeah, that was it. She wouldn't be able to qualify. Next slide. And maybe we'd like to go on to FAQs.
I think so.
Yeah. Okay.
Yeah.
All right. Let's do that.
Okay, that's me. And I think I spoke a little too soon on the housing payment billing date. That's most likely the time. We are ironing out the time. But I would save that on your calendar, and then in our follow-up email, we will confirm. But let's dive into some resources for housing benefits and eligibility criteria. Next slide, please. Okay, so this is our HRSN provider webpage. If you have not been to this webpage yet, I hope you bookmark it because this is where we keep all of our information for our partners like you all. We have a provider journey which walks through the steps of being a HRSN service provider. We have one that's from the member perspective and specific to housing. We have one on a document on eligibility, a document with the income limits, and a housing benefit fact sheet. And I know that we've hinted at AMI and the area median income being 30%, and we haven't actually told you what those numbers are, and I'm sure you're all curious. So you can go to the income limits document and see what those are there. If you could go to the next slide, please. And this is a sneak peek of what the eligibility guide looks like. It lists the housing benefits and all the benefit details. It lists who qualifies for HRSN housing benefits, what the qualifying health conditions are, how to apply for housing benefits, and then that income chart by county of what the area median income is, 30%. So a lot of the questions that I think you've all had as this training has gone along where you're like, I want more information, a lot of it is in this document. So we will include that link. And next slide, please. Okay, and so those are some resources. We'll share a few more resources in a bit. But now we'll go into some frequently asked questions.
Great, thank you. If you could go to the next slide. Okay, so these are some questions that have come up over time, and we thought this would be a good opportunity to address them. If a member's actual rent exceeds the rent cap for HRSN, can HRSN providers combine other funding to pay part of rent? Can HRSN be combined with other funding? This is a great question. We're hoping people explore this more. HRSN housing benefit may be combined with funding from other local, state, and federal programs. So if members who get a voucher support that covers a portion of the rent may get the HRSN rent and utility cost services if their voucher allows and does not consider HRSN a duplication of benefits. A member may get imminent eviction prevention support from a local state program and then get the HRSN rent and utility cost services to help them keep their housing. So you can be creative on how you want to, stagger it if that's a possibility. Next question asks, can HRSN cover rent for those who are already getting a rental subsidy? So HRSN housing services can cover rent for people getting other subsidies if the subsidy allows it, and HRSN only covers the member's portion of rent. So again, yes, if it meets the terms. Are HRSN housing services available to members who are homeowners? So rent and utility assistance is currently only available to members who are renting their home. It does not cover assistance to help members pay for their mortgage. However, home mods and home remediation can be available to homeowners. And we'll move to the next one. Okay, so what if we touched on this already a little bit. What if there are multiple members in the household who are eligible for HRSN housing services? Can all members get the maximum 6 months of rental assistance? Got this question a lot. HRSN rental assistance is available once per household over the course of the waiver, which expires in 2027. So if more than one household lives in the same physical space, each household is eligible for rental assistance once. So I'll say that again. If more than one household lives in the same space, each household is eligible for rental assistance one time. And then what are the living arrangements that a member can live in to be eligible for rent and utility costs? Below you can see what is allowable. Apartment units, I'm not going to read them all, but there for you are the living arrangements that a member can live in to be eligible. Will HRSN Housing Services pay for time spent coordinating and delivering HRSN housing services? So yes, HRSN housing providers can use HRSN tenancy services to bill for the time that is required to coordinate and deliver housing services and to work with CCO or open card care coordination teams. So they'll be able to pay for the time doing those activities. And I think we're going to move it on and open it up to the next slide. So I'll let you all, yeah, go for it.
Oh, thank you. Okay, we're finally at our questions and answers portion, and thank you all for your patience as we tried our best to not answer your questions immediately and didn't always succeed because we're all itching to answer your questions too. But we have tried to pull together the questions that haven't been answered already. And I might hand it off to my colleague Lori to start reading questions out loud, and then we'll have our subject matter experts on the call help answer them. So I'll hand it over to Lori if you want to read out the first question.
Okay, hello everyone. And I had kind of grouped some of the housing questions here and tried to prioritize them a little bit here. So my first question that I had noted down was, will children qualify for these benefits?
Yeah, thanks, Lori, and thanks to everyone who are putting questions in the chat. Appreciate it. I'll also just note we are compiling an FAQ document, and so you we'll be posting that on the HRSN provider website in the coming weeks. And hopefully, if your question isn't answered today, or if you want to review it again, you can also find it there. This is a great opportunity for us to see what questions are asked frequently and to kind of further flesh out that document. Okay, so will children qualify for these benefits? Yes. So if the child is in a household where the child has the qualifying health condition and the parents have the qualifying income, that can be combined for the whole household to be eligible for the benefits.
Perfect. Yeah. Let's see here. Next question we had was, can someone use these services to help find housing, or is this only for individuals who already have obtained housing?
Yeah. So thanks for this. So at this time, since this is a purely preventative model, preventing homelessness, we are only supporting people to stay in their current housing, not supporting people to move into new housing. I'm also seeing Troy's comment in the chat, which I think is related. So sober living homes generally have more than one person needing assistance at a time, but only one person can be eligible. So I think that we go back to the definition of household. We're using a Medicaid definition, which kind of corresponds to how you file taxes. Earlier in the slide, we had kind of a chart that could help people map out how many members are in a household. And in our income chart, which is online, we have that process mapped out again. So if someone's living in a sober living center, and provided that they aren't like members of a family together, but they're just individuals who live in the same physical space, but they don't file taxes together, we're considering that separate households. So a household is not defined by the physical space and more defined by kind of who's in your household. I hope that's clear. And we do have on the income chart document, we do have a bit more information on that. So Lynn, yeah, so I hear you on this. This program is unique in that we are trying to provide a resource for the doubled up population, considering that people may not have another housing option to go to at present. So this is an option. Of course, this hopefully will be a bridge to another service that can provide more of a sustainable housing option. So, Lori? do you want to go back?
Go to the next question
yeah.
that we have. Yes. No problem. Thank you for that. I appreciate it. The next one or next question I had noted was rent owed. Is that a ledger or showing months paid and not paid? So was there some clarification on like what type of documentation?
Yeah, it just has to be from the landlord, clearly indicating what's owed and not.
Okay, perfect. There was another question in regards to, do funds used for building permanent or temporary housing intended for members in need qualify as an HRSN expense?
No, we can't fund capital projects through this.
Okay.
If I understood that question correctly.
And I'm reading it verbatim, so I don't know if whoever had asked that question, if that was the intention of the question. Would you like me to go to the next?
Sure.
Okay. Let's see. The next question I have here is, if we are contracting to provide the housing benefit with one of our CCOs, but not both, do we provide the benefit for all OHP card holders, or only the one we are contracted with?
Yeah, and I can answer this, but I realize I've been answering a lot, so my colleagues should feel free to jump in. But yes, you can only be paid with the CCO that you are contracted with.
Perfect. The next question I have noted here is, when providing tenancy supports, is the expectations to perform the full scope of tenancy supports? If, for example, all listed under the service description, or can it be a limited scope?
This is a great question. So when you refer to the service description, I also want to just share for everyone, we have Oregon administrative rules that are set to be posted November 1st, which go into a lot more detail. And you can find this on the Secretary of State's website, and we'll also link to it in our materials. So the service description lists out a long list of activities that are allowable under tenancy supports, and you don't have to provide them all. You can only provide some.
Perfect. There's quite a bit more questions here. I know we were trying to prioritize some of the housing piece to this.
Yeah. Do you mind if I jump in real quick,
Of
Lori?
course, no
Thank
problem.
you. I think there was a lot of really great questions around provider enrollment and outreach and engagement. And just in the interest of keeping this housing focused, I think maybe we can start going into questions that are coming through that are housing specific. But my promise to everybody on the call that asked the provider enrollment and outreach and engagement questions is that in the follow-up email, we'll make sure to provide resources that address your questions. So we will answer them, just potentially not during this training right away. But with that, maybe we can start going into the housing ones that are coming through now, unless Lori, you had more that were housing related.
Actually, that was about really at the gist of the housing ones that I had noted. There was a variety of different questions, but those were the ones that were mostly around housing.
Great, thank you.
I'll answer Megan's question if we have time for it. So if you're
Please.
primarily an outreach and engagement provider, but you also providing housing case management, how would you go about getting authorization to provide tenancy and case management after someone's been approved for rent assistance? So this is during that HRSN request form stage that we went through those different kind of the process flow of being an HRSN service provider. When submitting the HRSN request form, that's when you indicate all of the services the individual is interested in receiving, so that they are authorized for all of them all at once. Maybe slightly confusing, tenancy services is always authorized alongside rental assistance, just so that if the individual initially declines tenancy supports but later changes their mind, it's there and ready to go. But I would say that's when that time of submitting the HRSN request form is really the moment to have the conversation with the member about what services they want and what services you're able to provide. I hope I answered that question. Yeah. Tanya, do you think we have a few more questions, and should we go with the
Yeah,
chat, or should we open it up for anyone who wants to raise their hand?
I'd say if you wouldn't mind skimming through the chat and seeing if there are others that stand out to you to answer, that would be great. We have time.
Yeah, so Liberty, I'm just seeing, does pre and post tenancy support only apply to those getting rent and utilities, or could it be for others who need other types of housing navigation? So the eligibility for tenancy supports is meeting that at risk of homelessness definition and having a lease. So it is fairly focused at this time. And then it includes all of the services listed in that service description, which we will provide a link to on our website once it's ready. It will be ready November 1st. And maybe the complex part of that is that an individual may be housed with a lease, meets the at-risk definition, but if they're interested in moving into a new place, say a more affordable place than the one that they have, that tenancy support can be used to help them through that process. So we do have that activity listed in there. And it is a standalone service. So someone does not need to be getting rent in order to be getting tenancy support. I'm seeing Lynn's question. If you do outreach and engagement, you should sign up for the services that you feel comfortable offering. Typically, how we kind of conceptualize it is outreach and engagement is the support to help a member apply for HRSN services. And then after tenancy support is authorized, then service providers can switch to billing tenancy support. And I might just pause. I don't know if my colleagues have identified any questions that they want to answer. I want to make space.
You're doing great, Callie. Thank you.
All right. How do we approach subleasing or other situations? So I think, this is another one we do need either a lease or written agreement from the landlord. And regarding legal eviction support, O&E or tenancy services can both be used to refer an individual to legal support. But in terms of just advice, like help communicating with the landlord, that can be billed to tenancy support. So I see Heather's question. This is a good one. So outreach and engagement does have a cap of 30 hours per member. But tenancy support does not. You can be providing tenancy support to someone for as long as they need. And Leslie, that is an outreach and engagement question, so I actually don't know the answer, but we can follow up on that.
Kaylee, or
Yeah.
excuse me, I apologize. I wanted to, I had a question in the chat that I didn't know it had been addressed or not, but it had to do with approaching subleasing and other situations in which there is no clear contract with the landlord.
Yeah, and that one, so we do need a lease or a written agreement.
Okay, perfect.
And Megan, yes, that tenancy support can include that, but they still have to qualify for tenancy support in order to get it. Megan's question on any type of promissory note. So that would, because OHA is contracting with our CCOs, we can't offer a promissory note template on their behalf, kind of just due to the contracting structure. CCOs may feel comfortable coming up with a promissory note, but I don't want to speak for them. And with open card, we haven't discussed that, but I think that would really be more for the housing provider to offer as opposed to for this at the CCO level for promissory notes. And I'll just pause if anyone wants to also, ask a question, not in the chat, or if any of my colleagues have a question that they see in the chat that they would like to answer.
I did have a question that I'm not sure if it got addressed, but it was regarding tracking the max of O&E if multiple providers are providing service. And I wasn't sure if that was something we were going to be addressing here because it's not, it's O&E related.
Yeah, I actually don't have the answer for that. So how it's tracked across multiple providers, I'd have to come back to folks with that.
Okay, perfect. Thank you.
Hey, Callie.
Yeah.
Jesse Wilson here with OHA. So that will be tracked at the health plan level. So the CCO or the or open card third-party contractor will help track that using the documentation that providers submit with their invoices. So providers don't necessarily need to worry about that. That will be well, they would worry about their own tracking of hours, but not other providers tracking. But we can follow up with more information on outreach, engagement, documentation.
Good
Thanks,
afternoon,
Jesse.
everyone.
Thanks, Lorenzo. Go ahead. Yeah.
I'm a sole provider. I'm not attached to any CBO. And I'm registered with the Oregon Health Authority. I'm also, signed up to be all the way across the board. Rental assistance with the housing and everything. And I'm running into an issue in regards, and I was hoping I would get a little clarity in this training. The issue I'm running into is the reimbursement and I'll give you an example, through Health Share. It says, well, Oregon Health Authority said I needed to register with them. So I went online to do that. Had a couple of conversations and they were like, no, you wouldn't get it reimbursed through us. You would be getting reimbursed through whoever that person or persons health plan is attached to. Well, most folks that have, on their OHP cards or Medicaid card will tell them where they're going. And in Multnomah County, the majority of folks are attached to healthcare. I mean, not healthcare, but health share. So I'm kind of stuck in this freezing moment because I have a few folks I'm waiting to touch, as soon as the doors open on the housing piece that have some severe health issues and about to become homeless because they can't go to work. But if I can't get reimbursed as a sole provider, I'm kind of stuck. And maybe this might not be an answer for you guys. I've been bouncing this around between Accentra Insurance and I hope I say it right, Anya, A-Y-A-N. Did I say it right?
Ian, yeah,
Ian,
the hard one,
forgive
right?
me. I haven't had all my coffee today. And so it seems like I've sent quite a few emails out, and I cannot get a clear answer. Have you guys well, I guess you haven't ran into it because the housing piece doesn't open up till November 1st. But have you guys had, or has there been discussion about, hey, we're probably going to have some sole providers. We're going to have some folks who are not going to be attached to, a community-based organization. I've been doing, community outreach and engagement, housing and all that, for 20 plus years. So that's really my question. It's probably 2 or 3 in one. Forgive me.
Yeah. Thank you for that. And thank you also for your work. So I don't think I have all the answers, but I'll see what I can do. And then also if my colleagues have anything more. So the first step is to enroll with the CCO and open card. And so you would enroll not just in our in the MMIS system, but also enroll to become part of HealthShare's provider network. as well as enroll to be part of the open card network. So that is a like kind of more formal like contracting process to become one of their providers. And they're currently in the process of developing their provider networks now. So that's one place I would start. The next piece is that if you enroll as part of HealthShare's provider network, they should have guidance, billing guidance on how you would get reimbursed. And similarly for OpenCard for IAN, we do have a provider training on how to get reimbursed from them. So it would depend. So I guess there's two things: the individual that you're working with, the member that you're working with, who like which health plan did they have? Did they have open card or do they have a CCO, and which CCO? So making sure that you are enrolled with the CCO or open card that the member you're working with is enrolled in so that you can get paid. Does that help at all?
It does, and it sounds like it's another two steps on what I did with the Oregon Health Authority. If I'm hearing you right, on top of enrolling with HealthShare, I'll also have to do it. Would that be specifically with the Oregon Health Plan?
With open card, you mean?
Yeah.
Yes, and we do
Okay.
have a training on how to how to enroll in our system. Jesse, do you know if it would be reaching out to Accenture directly for instructions on how to enroll as one of their providers?
Well, no, let me make sure I said
Or
this right. I just completed all that with Accenture.
with Accenture?
Yeah. That was
Okay.
a real strenuous process,
Oh,
but
okay. Sorry to
I
hear
got
that.
through it. Yeah, that part's behind me. Got my Medicaid, number. I have a national provider identification
Mm-hmm.
number also, which
Okay.
allows me to, bill for fee for services, et cetera, et cetera. That goes all the way back to when I was working for Cascadia Behavioral Health Care.
Got it.
I think I'm kind of following it. Once I can get in to healthcare, health share system. Yeah.
Yeah.
But
Um,
it directed me back to IAN. Like when you go to their portal of providers, click on providers and it goes down, then it says go to IAN help
oh,
desk, and then
okay.
you submit like some kind of request, like, hey, somebody get back to me. And
Right.
I did that. Yeah, I did that. And nobody got back to me. And so then I went back to Accentra, and that's where I'm at now. We're having some conversations, like, okay, what's the next step now? So I'll try it
Got
again.
it.
Sorry
All
to hold
right.
everybody up.
Yeah,
That's
no
okay.
worries.
I'll
Yeah.
just say, yeah, we can check with you offline and see what kind of technical assistance and help you resolve any of those issues. And happy to do that with other providers as well.
Anytime I can get some extra eyes, I'm all for it.
All right. Well, I hate to be the time person, but we have 2 minutes left, so I might close this out. And if my headset stops working and you can't hear me, then maybe I'll ping help. But if you wouldn't mind going to the next slide, please. One more. All right. So I think we've talked a lot about enrolling as an HRSN provider. Here are some links. I've dropped them in the chat. Um, enroll with CCO, enroll with OpenCard. There are 3 links on this page that if someone could help me drop those in the chat. These are 3 web pages that I encourage you to bookmark. They are a HRSN webpage that has general HRSN information. The HRSN service provider webpage has all the resources that you'll need as an HRSN provider. That's kind of the main one that has everything that you'll need. It'll get continuously updated with resources for you. And then our provider training webpage, that's where this training will live when we publish the slides. We'll email them out, but this training, all future trainings, all past trainings, they're going to live on that webpage. So those are all there. Thank you to my teammates who are posting those in the chat. Next slide, please. Our next training is next Tuesday, It's all of this same content. You are more than welcome to join us again, but it will be the same thing. But tell your friends, tell your colleagues, and we would love to have more folks at that meeting as well. And then we have on our training webpage some short pre-recorded videos. Next slide, please. Sorry, I'm going so quickly. And lastly, but most importantly, if you could please give us your feedback. This is an anonymous survey where we would love to hear if you found this training useful. If you would like more information in future trainings, different information, a different format, we would love to just hear your thoughts. At the top of that survey, there is a drop down that says which type of training are you giving feedback on. Please select a live session for HRSN providers. And if someone could put the link for the survey in the chat, that would be great. Clarification on timings of trainings. I know there's a comment in the chat. Today's session was kind of a add-on to our normal regularly scheduled trainings because we wanted to add one more session this month. But normally we do them at the end of the month from 1 to 2:30. So next week it'll be from 1 to 2:30, the same content as today. And then as I alluded to earlier, next month we're hoping to talk about housing, payment, and billing. So stay tuned for more information about that. Sorry for the quick end here. I know we are right at time, but thank you all so much for your partnership in this work, for hanging on with us as we tried to give you a ton of information in a short amount of time. I appreciate all the interactive questions and that you are all willing to do this new and exciting work with us. So thank you all so much. Thank you to our partners on the Waiver Housing team for joining us for this session, and we will see you all soon. Thanks, everyone.
Thank you,
Bye.
guys.
Thank you.